Hello, Dr. Glenn, resident vet for Vet and Pet Direct, talking today about urinary incontinence in dogs. It is a pretty common problem that I see in practice. What is urinary incontinence? It is where the dog has urine coming out of them and they don't know about it. That can be a couple of different presentations. Often you'll see the bed is wet, either a big wee patch or a small wee patch, and that is certainly urinary incontinence when they're asleep, or nocturnal incontinence. There's also when they're awake and they can be just dripping urine, or they'll be urinary continent for most of the time, but then will become urinary incontinent and they will be dripping urine. Happens in both males and female dogs. Certainly females are significantly more prone to urinary incontinence, and we'll go on and discuss why. Hormonal urinary incontinence is the most common cause of urinary incontinence in female dogs. Desexed female dogs have about a 3 to 5% chance of developing urinary incontinence during their life. That is nearly always a nocturnal incontinence, so it's a problem when they're asleep. And you'll usually notice it initially, you'll just get a few wet patches in their beds intermittently at the start, so it'll just happen once and then it'll happen again a couple of weeks later, but eventually it happens quite regularly and it becomes a big problem. A, dogs don't know why it's happening, but B, you can get secondary urine staining and urinary scalding dermatitis around their vulva, and it's not much fun. And wet beds, urine beds, that's not much fun either. So hormonal incontinence is certainly a big part of what we see. There's lots of other causes as well. Dogs with various health conditions will increase the amount of urine that they produce, and if you're making more urine, well, you're more likely to be urinary incontinent when you're asleep, but also it can happen when they're awake as well. So conditions like diabetes, excess cortisone production in the body, which is Cushing's disease, certainly kidney problems where you're producing more urine than you should be, and medications like cortisone administration that increases urine output as well. All those things can cause problems. There's other health conditions as well, like neurological problems or even infection problems. Urinary tract infections can affect the little sphincter that holds urine in. So we certainly see dogs with spinal conditions, neurodegenerative disease, arthritis are more prone to incontinence further down the track. Male dogs are generally less involved, but certainly we see prostate disease in male dogs that are entire, and that's benign prostatic hyperplasia, and in some desexed male dogs actually get prostate cancer, and that can cause problems as well. Non-desexed female dogs can get a condition called pyometra, which is a uterine infection, but as part of that condition they actually get increased water intake just because of their prostaglandin pathways, and I have seen pets that become urinary incontinent and they're making more wee because of the pyometra. So essentially, if your dog's weeing the bed or if they're leaking urine when they're awake, it's not normal. You need to get your vet involved, get a vet diagnosis, take a urine sample if possible into your vet, because we need to rule out things like urinary tract infections, which are easily treated, and that can be the cause of the problem, or they need a workup to make sure there's nothing else going on before you start down the course of hormone replacement therapy or medications that can help to control the disease. That's a big part of it. Get a diagnosis, find out what's going on, and there's definitely treatments for those different things. The hormonal incontinence that we see, we do use hormone replacement therapy. There's no prescription medications that haven't got potential side effects, and there are some infrequent but very nasty, occasionally fatal side effects from hormone replacement therapy in female dogs. There's another medication called propranolol that we use, which increases the muscle sphincter tone that keeps the urine in the bladder. It stimulates the nervous system, and most pets are fine on it, but it can have a wide range of adverse effects, including excitation and diarrhea and vomiting and all sorts of things. But basically, your vet will go through what is the best treatment plan for hormonal incontinence if that's what's going on. And if they've got arthritis stuff, well, there's all the treatment and supplements for that. If they've got prostate problems, obviously getting a diagnosis and treating that. So get a treatment plan, and then you know what's going on, and we can fix nearly all of these problems. Hope that helps. Thanks, guys.